basically almost all the fat soluble toxins, are there, which is most of them that they're floating around the blood. The or I said herbicides, pesticides, and the forever chemicals, PFASs. Those come out.
Hey, this is Ari. Welcome back to the Energy Blueprint podcast. With me today for the third or fourth time is my friend, Dr. Eric Gordon, who has spent the last 45 or 46 years of his life working with some of the most complex, difficult to treat patients in all of medicine. These are the people with complex chronic illness who have seen every specialist, tried everything, and still can't get answers, can't figure out how to get well. And this is kind of his unique specialty and his gift, is working with these kinds of very, very difficult to treat patients. And I love his way of thinking. I love his framework, and I love the way his mind works in general. He has a way of connecting the dots that's very, very interesting. And I think that you'll hear that in the way that he discusses things. So a little bit more about him. He's the medical director of Gordon Medical Associates, president of the Gordon Medical Research Center, where he's built a reputation for doing what most doctors won't, which is looking beyond the diagnosis to find what's actually driving a patient's illness and figuring out the right order to address it. His clinical work spans Lyme disease, ME/CFS, autoimmune conditions, and mitochondrial dysfunction, and lots of other kinds of dysfunction, often all at once in the same patient. In 2016, he co-authored a landmark study with Dr. Robert Naviaux, also a former guest on this podcast, and a bit of a personal hero of mine, someone who I think has done some of the most important work in medicine of the last century with his work on the cell danger response. Dr. Gordon has worked with him and published a paper in the Proceedings of the National Academy of Sciences with Dr. Robert Naviaux. And that paper has fundamentally changed how researchers understand the metabolic underpinnings of chronic fatigue syndrome. This was a critical paper in helping to shift what had historically been seen as a more psychogenic disorder, because on traditional blood tests, ME/CFS, people complaining of chronic fatigue, severe chronic fatigue, often no abnormalities show up on regular blood tests. So that led for a long time to people to see it, oftentimes doctors, to see it as a psychogenic illness. It's all in your head, basically. And what this paper did was it was critical in helping to establish that there are very real metabolic biochemical changes in the body. This is not purely a psychogenic phenomenon. Dr. Gordon is also an internationally recognized voice in this space, and he's regularly invited to speak at prestigious medical conferences. And he's dedicated much of his career to bridging cutting-edge research with what actually works in the clinic. So with all of that said, today we are talking about plasmapheresis, which is a fascinating new technology. Lots of new research is being done on this. People are using it to treat different illnesses, complex chronic illnesses, and it's also being used by people who are already well in the pursuit of longevity. And there is an ongoing stream of new research, some of it very exciting research being published on this topic. So you are going to hear from one of the experts on it, Dr. Gordon, who's going to tell you what it is, who it's for, who it's not for, how you should do it, what you should do before and after, the nuances of, all the stuff of what it's doing, what it's not doing, and maybe some stuff on the right way to approach this and whether it's not for you, or whether it is or is not for you, I should say. So with all of that said, enjoy the podcast. Eric, welcome back to the show. Always a pleasure to connect with you. And it has been far too long since our last conversation.
Yeah, same, Ari. I always learn and appreciate your perspective on health and health wellness, and I think sometimes the missteps of those of us who are the disease hunters. So.
Well, as we were just chatting about before we started recording, you and I come at this topic of health from such different directions, and yet whenever we talk, we always manage to find so much commonality, and so there's so much interesting conversation that takes place at that intersection of where our two worlds collide. So I'm excited to explore that once again with you for the, I don't know, you've been on the podcast at least 3 times, I think, in the past. So maybe this is number 4.
Yeah. Or third, I think, but who's counting? It's really a pleasure to be here because talking to you, I get to think about things and create ideas because that's what's amazing. It's like you are you're an explorer, and that's what's I think we need in this world of people who are looking for the next quickie, so to speak.
Of course, I feel the same about you. So let's get into it.
Yeah. So.
So, what have you been exploring since our last conversation?
Yeah.
What's new in your world? You were telling me before we started recording a little bit about attending medical conferences, kind of some new medical interventions that you've been working with some of your complex chronic illness cases. What's the latest big picture? Just kind of tell me about what's going on in your world.
Okay. Well, I think the big picture is sort of I'm kind of bringing together a very high-tech intervention and a very low-tech intervention, and they both need each other sometimes. Okay, because one of the big things that's happened in my world is that I've been doing a little bit more work with people in the longevity world than I used to. I think one of the things that we talked about before is one of the reasons I got into medicine now 46 years ago, a long time ago, trying to figure out what people needed to stay healthy. What was a healthy diet? What was a healthy lifestyle? And, I was in medical school 3 months and I go, I'm not going to learn about this here. It was really crystal clear. They had no clue. And,
that was my realization in medical school too. And that's why I left after 2 years.
Well, I was a better Jewish son.
You were.
I went through it, and actually I had fun because I always, you get to talk to people. I mean, I love people and I love listening and figuring out, how to help. And so it was amazing. But it was always disappointing because it was always about plug the hole, fix the problem du jour. What I call Band-Aid medicine, which I think I've gotten pretty good at over the years because that's what medicine has to offer is good Band-Aids. The whole idea of modern medicine is let's keep you alive until your body figures out how to heal, or we just keep you alive. And, the compensations that the body makes for the stressor, for the illness, for the bug, for the injury is something that's designed to be short-term. Okay, everything the body does for immediate survival, to fight something, or I always compare it to the psychological world. Anger is a healthy emotion, but it should be a transient emotion. It should be a transient activity. And the same thing is true of my other favorite subject, which is inflammation, which is basically how your body protects you and how it starts the healing process is through inflammation. But this should be a transient event lasting days, weeks, maybe months if it's a big injury, but it has an on and an off and a cycle. Now, chronic illness is when that cycle is really interrupted and you're stuck in a big inflammatory state. Aging, I think, is a slower version of that, where the injuries of life just build up. And you don't, when you're lucky, when you have an injury, you repair the cells that you can repair, and the cells that you can't repair, well, will die. Apoptosis, as they say, programmed cell death, very clean, very nice. It doesn't make a lot of, debris. And, you go on. Unfortunately, that rarely happens 100%. As we live, as we get injured, as we get stressed, as we overexercise or, do anything, there are some cells that don't complete the healing cycles and don't die. And in the modern parlance, people are calling them zombie cells or senescent cells, is we look at it. Or, as in Dr. Navio, in Bob's world, it's cells stuck in some point in the cell danger response, But whatever your
For
definition.
listeners who are unfamiliar with what he's describing, I'd recommend, first of all, looking up Dr. Robert Naviaux, who Eric has done research with and worked with very closely for many years. And this is all material on the cell danger response that we've discussed in recent podcasts. It's Eric, maybe you want to tell them briefly a bit about
Yeah,
the
well,
cell
just
danger response, just to keep
very
catch
briefly.
anybody up who is unfamiliar with that.
Yeah, and I've learned how to do this in very brief terms, which is good. But I also want to say is that I've supplied Bob with patients for research. He does the work and he does the brain work. I sit there and go, oh, that's a good idea. More of that. The cell danger response is a model to understand how the body heals and really how the body stays healthy. And it's a model that includes every part of it. Okay, there's no one. People often say, "Is that the cell danger response?" Like when they have chronic inflammation or they have Lyme. Is that the cell? It's all. It's a story to explain how your body works. And briefly, it just says that when there is an injury in the body, and it doesn't have to be a big injury. Think of just exercise. You have when you exercise hard, some of your cells are stressed and they need to be repaired. Now, if you've really torn some things a bit, you'll create local inflammation. Okay, that's the CDR1, that local inflammation, that transient inflammation, and this is all controlled by the mitochondria. And we're not going to go too far into that story, but just believe me, Bob has put the mitochondria in the middle of this. To be fair, in any time you talk about physiology, it's all a circle.
Yeah.
So there are other people who have their other favorite organelles, but
some people's favorites are the thyroid or the adrenals or the
but right, but those are the glands. But every cell in your body except red blood cells have mitochondria, and the mitochondria's job is to sense the environment. And I think this is a key piece here. The environment at the very basic level is electrons, but at the more higher level is your raw materials. Okay, the things your cells use to make proteins and to make membranes and to make all the organelles. Remember, the DNA is like the blueprint. The enzymes are like the machines, but the raw materials, the lipids and the simple amino acids and sugars, those are the raw materials. Okay, and they're all and that how they flow through the cell is very closely monitored by the mitochondria, and the mitochondria will turn off, turn on, make more ATP, less ATP, make more proteins and make more components that you use to make more DNA or more RNA or more proteins, depending on what that mitochondria is sensing. When the mitochondria senses that there's a problem, it stops making a lot of ATP and it lets your cell burn glucose for energy. That's the CDR1, that using glucose for energy and signaling to other cells that there's a problem. Okay, CDR2 is when you're rebuilding. Okay, the cell's been injured. The little luck, it can rebuild itself. It also, and at that point, the mitochondria still is not making ATP for a lot of energy. You're still kind of dependent on glucose, and this is where cancer cells are stuck. That's what things in the CDR2 use glucose for most of the energy. So CDR3 is when the cell is maturing. It's now becoming a member of the organ that's part of. Because remember, cells are very different organ to organ, and they have different mitochondria in them too, but that's another story. And in CDR3 is when the membrane is maturing, and it's now accepting information easily. Because in that first cycle of CDR1, the cell membrane kind of thickens and stops letting a lot of information into the cell. In CDR3, your hormones are now giving that cell information, and all the little chemicals at the neighboring cells, the communication is working, and it's learning how to be a liver cell or a retina cell or a heart cell or wherever it happens to be. Now, this is a very nice process. This is life. This is healing. It happens in every organism we've ever looked at. But when that inflammation is part of your life. It's how you heal every day. It's how at night, this happens in a very subtle form through the night when you're rebuilding tissue. The cells usually aren't as completely isolated as they are in the injury state, but the different metabolites are kind of happening the same way at night when you're healing. Now, as we age, we accumulate cells that have been left behind that are, some of them are still in that inflammatory stage. They haven't finished that cycle. So they're releasing signals that are inflammatory. Okay, they're saying we've got a problem here. Now, if it's 1% of or a half a percent of the cells in your liver, it's not a big deal. But as we age, it probably grows in number, and these information molecules can be everything from exosomes to cytokines and to bigger proteins, that they're all signaling that we're trying to heal here. We're not finished. And this creates those low levels of inflammation that we're all worried about. And if it's in the liver that's happening a lot, you might be somebody who has an elevated CRP, the C-reactive protein, which everybody's looking at. But the problem with CRP is you can be pretty sick and have absolutely normal CRP. It doesn't mean that you're healthy. It's a signal, but it doesn't mean for sure. So this chronic inflammation that we all develop at some level over life, we accumulate senescent cells, which are releasing these senescent associated proteins that are wearing us down a bit because they're not letting us know that they're not letting metabolism work optimally. And if this happens in your gut, okay, and it does. It happens in all of our guts. But if there's a lot of inflammation in the gut, it can interfere with the absorption of trace minerals, because what the body does in like the CDR1, when there's a lot of inflammation, the liver releases a chemical called hepcidin. Hepcidin is a protein that kind of tells your iron receptors and your iron transporters in your small intestine, and the same transporters that also take in most of your trace minerals, zinc, copper, molybdenum, manganese, and a few others, to stop absorbing stuff. Because that CDR1, remember that CDR1 is a protective mode, okay? So it's trying to starve the bugs that might be invading your body. And it's a fine transient strategy. It's a fine thing. There's no problem if you do that for a day, a week, a month, a few months, because you have pretty big supplies of trace minerals in your body. However, if it goes on for years, they begin to diminish. And when that happens, your vitamins don't work well, because almost all your vitamins require a trace mineral cofactor in order to work optimally. And what vitamins do, they're enzymes. Okay, they help enzymes work better. Okay, and enzymes get reactions to work faster. So you don't die, you just work slower, less efficiently. And that means you build up more crud and you tax more systems. So this is basically how we age and how we become chronically ill. The question is one of degree. And I think I'm going to digress to one other point that I think is real important for people who everybody's on the internet now, and everybody's listening to podcasts and talking to AI. And if you do that, you get these stories of how the body works, so similar to the ones that I just gave you, but about particular chemicals, like NAD is a big one these days. NAD, this and that, and it's all real and it's all true. But what we don't understand, because it's hard for us to conceptualize, is how much redundancy in the body there is, and how not broken, but how deficient you can be and still be functioning. Remember, people survived Auschwitz. People came out looking like 98-pound skeletons, but they were living still. And they were deficient in probably almost everything. So there is an amazing redundancy. And so you have to keep that in the back of your mind and not freak out every time you read that I might be low in this or that. Because now, the thing that catches people is occasionally you're going to find an individual who is low in one thing: copper, zinc, calcium, magnesium, B12, folinic acid, pick your vitamin, your mineral, and they take it and whew, they're better. That happens, but that's not generally the case. Usually it's a much more complex, interwoven milieu and we can be deficient in lots of things and do quite well for a long time. So I just, because my own mind goes there. I mean, that's why I said I never met a supplement I didn't like, because when you read about them, they all sound like, my God, I should be taking that. It's going to make me wonderful. And yes, it may, but the chances are that it's only one piece in this incredibly complex piece of creation. And I think that's our other problem is we keep thinking of the body as though it's a machine, and it's not. And that's why AI it helps us tremendously, but because we still don't know the rules of the road, we still don't know how this thing really works. Everything has to be taken with a grain of salt. Okay, so
Yeah, can I add one more thing to that?
please.
I agree with everything that you said there. I would also say that it makes me think of these sometimes in textbooks, in medical textbooks, you'll see someone put together like an infographic of multiple different biochemical mechanisms, not just one simple little piece of the story. Like, here's how NAD plus works. Here's how the electron transport chain in mitochondria work. Here's the Krebs cycle. Here's the this. Here's the that. Here's how glycolysis works. But you see sometimes these images where they're overlaying 50 or 100 different processes on and trying to capture it all in one image. And immediately what happens when you look at one of these images is the eyes glaze over, because you look at them and you go, no human could possibly understand all of this complexity that's happening here with hundreds or maybe even over 1,000 different arrows pointing to this enzyme and that enzyme and this process, and then this whole thing feeds back into this. But even that doesn't even really capture anywhere close to the real complexity of whatever is even pictured on that page, because you also have all these feedback loops and unpredictability of different feedback loops and unpredictability of, since the body is, to your point, not a machine, which is, by the way, the fundamental error of biological reductionism.
Yeah.
It is unpredictable how the body will respond to certain inputs. It doesn't work just like a normal machine where X causes Y causes Z. X may cause Y, which feeds back onto B, which may impact E, which may, and so you have orders of magnitude, even more complexity than whatever is pictured on this page. And so, I laugh at so much of the biological sort of reductionism that we have today, where people say, oh, there's this one biochemical, and if you just take this supplement to boost this biochemical, everything's fixed because this is the one key biochemical. Like, this is such bullshit.
And remember, at the end of the day, so I'm talking about the mitochondria, but then at the end of the day, you have this central processing unit up here, which whatever magic happens in our brain, okay, can turn off and turn on all these systems.
Exactly.
In ways that we don't understand. And that is why people call them miracles. That is why people can heal from diseases that we don't think anybody should heal from occasionally. And that's why they're miracles. You can't count on it. But the mind, the soul, the spirit can shift things in ways that we still have no clue about. But at the end of the day, and what I always want to point out to people is that a good attitude helps healing. But I have also met really nasty, ugly, not happy people who heal. So I always like to throw that out there, because it's usually important to have a good. Because I see you have a much better chance of healing with a better attitude, and you will actually enjoy whatever life you're having, even if you are sick, with a better attitude.
Yeah.
So there's a lot to be saying for that, but still, it's not. I hate to see people who get locked into this idea that, well, if it's not the nutrient I need, it's the right mindset. And again, all these things are important. It's not that I'm saying that you should pay. I pay a lot of attention to what nutrients, and I try to pay a lot of attention to what your spirit and your psyche and your moods are doing because they all are affecting, but none of this is absolute. And that, none of them are bullets. And I always hate to use but that's the truth of it. Bullets, 99.9% of people react the same way to a bullet wound. I mean, there's always this huge person who probably needs a bunch of bullets to them. But, but life isn't mostly bullets. Life is mostly subtle things that are slowly toxifying us and slowly interfering with our function. And this kind of hooks into one of the things that my other big thing these days is plasmapheresis. So I want to get to that. But again, it's not a miracle, but it's a help, because underlying what I'm seeing, what I think I'm seeing in the world today, is that, and what I think is leading to why people are, if you will, less well than they used to be. Maybe not always, I mean, sometimes a lot sicker, but lots of times just less well, in the sense they have all these sensitivities, all these allergies, all these things that really make them feel bad, that seem to be very mild in the huge biochemical sense. It's because our world is literally, in the last 120 years, it's become more and more full of toxic load. And it's gone astronomical in the last 40 years. But really what's so interesting, I always forget, who's the fellow who, the German Jewish scientist who Hitler kept alive, who oh yeah, the who wrote about the fact that cancer cells depend on glucose. But the
Yeah.
point is that the reason he was working on cancer because the Germans were amazing chemists in the turn of the
Warburg.
century. Warburg, yeah, the
Yeah.
Warburg effect. Okay, well, and he because petrochemicals were the new thing. Okay, I mean, organic chemistry really started in the late 1800s. And we just started filling the world with these, petroleum-derived chemicals starting in the early 1900s, and that's when cancer rates started to go way up. And now besides cancers, because we have this huge rate, and when I started training, when I was as a young doctor in my first 20 years, I saw one colorectal cancer in somebody under 40. Just didn't see it. And now people are dying. I mean, things are changing. I mean, we have the autism world, but it's just all these things. We know that the toxins are a big thing. And that's when we talk about health, and we're really kind of stuck because they're part of our environment. People talk about microplastics and nanoplastics, and I said I was just at this meeting this past weekend at UCSD, actually, on plasmapheresis. It was a regular medical meeting. I don't go to a lot of them, but this was real doctors from all hospitals, all hospitalists, because this is a very subspecialty part of medicine. But one fellow, because there's so much talk about microplastics these days, and a lot of people are saying, oh, plasmapheresis will remove your microplastics or your nanoplastics. And he made the point that they do come out in plasmapheresis, but you probably have to do, I don't know, I estimate probably about 30 to 50 to make a significant dent. So that's not the answer. Even though I think plasmapheresis is the answer for some things, it is not the answer for getting rid of your microplastics. It's a good selling point, but it's part of the thing that I think you and I share is the disappointment with the people, the salesmanship in this field.
Mm-hmm.
We are here sharing information, and we want, and so it is, on some level, it is salesmanship, but we want it to be kind of on the reality plane. And I think the idea that you're going to remove your microplastics with plasmapheresis is a little on the salesmanship kind of things. Like, maybe you will. I mean, it's not that it's a lie. It's just that, I mean, we're kind of stuck with them because most of it we just breathe it in and we get it in our in our water supply, in our food. It's I mean, we can do things. Don't Don't eat out of plastic stuff. Don't buy stuff wrapped in, we can lower our plastic load. But anyways, plasmapheresis isn't going to fix you. But
Let Eric, let's step back for a moment. And
sure.
there are some listeners, probably many, that are unfamiliar with plasmapheresis and what it is, what it does, and who would it be for, and
Ah,
to what purpose. So let's go back to first principles here. What is this technology of plasmapheresis, and what are you using it for?
okay. It's an old technology. It was, I think, the animals that were doing it in the mid 1800s, but in like early 1900s, they figured out that they could really do this safely in animals. And in the 1950s, it's a filtering process. Apheresis is separation. It's a filtering process where people stick two large needles, one in each arm, usually, if you're lucky, and your blood goes out one arm into a machine. And in America, the most of the machines are we call centrifugal. They spin around and they separate the blood into different components based on its weight, on its density. So and you can take off any component. Most of the time, plasmapheresis, well, initially was well. Actually, it was used in the beginning to get cells that they wanted in the 60s, because when they started doing chemotherapy, they started needing a lot of either red blood cells, white blood cells, or platelets, and it was very hard to separate these. And using this machine, you can do it quite well. But then it began to be used later in the 70s and 80s a lot for autoimmune diseases. Okay, where it could separate the plasma, it could take out the plasma. Plasma is the liquid component of the blood. Okay, your red blood cells, your white blood cells, your platelets are more the solid material, and the plasma is the watery stuff. And with plasmapheresis, you can remove the plasma and reinfuse back the red cells. Now, if you take a lot of the plasma off, which is what's usually done, you need to reinfuse albumin, which is a protein that basically goes through your body and sucks up toxins. It also is very important because albumin is the main component that gives what we call osmotic force. I mean, you need particles. I'm going to go into chemistry here, but if you don't have enough particles in your blood, the blood will leak out into your tissues. So you need enough particles in the blood to hold the fluid into the bloodstream. And albumin is probably the main component that does that. So when we take out a lot of it, almost all of it that's in circulation in this plasmapheresis, we have to put that back. Now, this process is mostly in the hospitals, in the acute care setting, it's mostly used to remove antibodies. There are illnesses like Guillain-Barré, myasthenia gravis, lots of renal diseases, lots of neurologic diseases where you have autoantibodies that are attacking your tissues. And this is an amazing Band-Aid, talking about Band-Aid medicine. This is the Band-Aid par excellence, because we remove those antibodies and the symptoms will improve. But it doesn't really change the system usually. You still have to let the body heal or do other things to stop making those autoantibodies, or you have to do the plasmapheresis again.
Right,
And
and what's the timeline for making those autoantibodies?
oh,
I mean, if it's manufactured every day, then the relief that you get from plasmapheresis would be minimal to.
well, surprisingly, this is the interesting thing. Surprisingly, the autoantibodies, they're made every day, but the amounts, when because it's a body, when you take out all this stuff, all this information, okay, it gives the system a chance to reboot a little bit.
Yeah.
And so sometimes it stops doing it quicker,
Interesting.
because basically, like things like Guillain-Barré, many times people would recover from if you could keep them alive long enough. The inciting event was gone, and the antibodies that the B cells that were making these autoantibodies would not get the signals to keep reproducing, and so they would go away. If things are working, I mean, again, because remember, these autoantibodies are not all bad. We won't go there, but I'm going to go a little.
Go there. Go there.
Okay,
Go there.
okay. I don't
Yeah.
know. I don't know who's going to listen to this because we're going all over the place. But in like long COVID is a very good example. Okay, long COVID, there's a subset of people with long COVID, not everyone, but a subset of people who develop a lot of autoantibodies to their adrenergic, and muscarinic, these receptors that help control blood pressure and pulse and your autonomic nervous system. And in some people, when you remove those, they do quite well, and other people not so well because other things are keeping them going. And usually, if you're trying to remove autoantibodies as a therapy, you have to do 5 to 7 of these over, 2 weeks. Yeah, 2 weeks to 3 weeks. I mean, if it's an emergency in the hospital, so they'll do people every day. But that's a little iffy because we also remove something called fibrinogen and some other clotting proteins that take time to rebuild. So most of the time as an outpatient, it's nice to do it I like to do it every 3 or 4 days because that leaves plenty of time for rebuilding these clotting factors. But if something's acute, you can do it much more often. But generally, so you need 5 to 7 to get rid of all these autoantibodies. But yes, you're making more of them. But sometimes in some people, when you remove them, the signal goes away, and those B cells that are busy making all those autoantibodies, because they come from your own B cells, will stop doing that. Because the Treg cells, the T cells well, they don't really control. See, that's the other thing you talk about, if you remember, in the body. There's very rarely a linear control thing. T cells, you have Treg cells that in our minds we say they control the B cells, but they don't, because there are diseases that are caused by the wrong number or the wrong type of T cells. And when you remove all the B cells, sometimes that gets better. So, as you said before, everything causes everything in the body. So,
Real quick, I think one interesting principle that you're alluding to there, I think that there's a broader principle at play, which is, and I think it's kind of an overlooked but important principle, is the idea of changing something, meaning like when the body is stuck in a certain state, simply just creating a shifting the body in a particular direction creates an opportunity for a space, creates an opportunity for new signaling to go on, that I think you even use the words to reset.
absolutely.
It's a way to detect. It's almost like, my way of conceptualizing it is like the body gets used to a certain state, and then it stops sensing the signals of the fact that it's in that state. It just sort of normalizes to it. And by perturbing the system in a particular direction, it gives the body an opportunity to sense what's going on and where it wants to regulate that set point at.
Absolutely, and that's why herbs are so cool, because they send lots of signals, and your body gets a chance to see which ones, because they're perturbing. I mean, most herbs kind of push the system, and then it's a counter-regulatory thing that creates the change. Removing all this plasma, okay, that's what, to my mind, is exactly what you described is what's happening. When you remove this plasma, we're allowing the space for new things to happen. We're allowing the space for the body to self-regulate again in a more healthful manner. Okay, because we removed some of the alarm signals. And again, they're transient, but the cool part is, when you're alive, life is a transient experience. I mean, life, biology is a moment to moment communication and explosion of information, if that makes any sense. And when you change the information, you change the biology, and you allow new things to happen. So that's the beauty of this kind of approach. Because I said, usually in medicine, we go in there, and modern medicine is getting better and better at this. We are our tools, a whole bunch of these immune treatments that we have, all the mAbs and inamAbs and all these things, these chemicals that are very specific now. They can go in, they can target one particular cytokine, one it's inflammatory chemical that might be causing a problem. And by targeting that, you can stop the inflammation. Now, unfortunately, they don't usually realize that if they target a few things at lower levels, they might be able to change the milieu and let the body then find something new. We're still stuck in like, we're going to go in there and we're going to like change this one system, we're going to block this one chemical, and then we have to keep blocking it most of the time because that wasn't the, because it's really hard to find the beginning of a circle. When you cut the circle, sometimes it will reform in a different manner. But when you just cut it in one spot and you have a lot of things driving, you just reform it over and over and over again. So that's the beauty of this plasmapheresis, which is, because it's dirty, because it's not so specific. But medicine is hooked on specificity. They think the more we can do exactly what we want to do, the better. But that is based on the idea that we know exactly how this system works.
Exactly. Yeah, which is a far bigger flaw than I think anyone wants to admit, and is a massive flaw that people rarely actually discuss in the way that you just did. But yeah, I agree completely. I think there is this implicit assumption that the more we zoom in, the more we go to the micro level, the more we are going to figure out exactly what specific mechanism drives this specific disease. And I think what systems biology is telling us is that whole premise, that whole foundational assumption of biological reductionism is a mistake, is an error in most cases, because the system doesn't actually work like that, where it is just that one thing that if you target that thing, it cures the disease.
Yeah, but exactly, and it's, but we don't want to throw out the baby with the bathwater. Sometimes I love the details, but we have to remember that we don't really understand enough about the system to count that we have the right detail.
Right.
So we have to go, and in my mind, we go back and forth between these two models because they both have usefulness, and you need one more or less depending on how, for lack of a better medical term, how screwed up your body is.
Agreed.
That's the thing. So the plasmapheresis, where the longevity play is coming in, which I think is really exciting.
Let me back up and just segue into that. So there's a use for this technology, plasmapheresis, as you've been describing, in the cases of many different kinds of complex chronic illness.
Right.
But there is also this other category of use that's becoming more popular now, of the already well, people who are already healthy, who are looking to optimize for longevity, who are now using this technology on a regular basis. So talk to us about that.
Well, actually, before I go there, I want to just be real clear that I think in chronic illness, this can be useful, but in both chronic and in longevity, what you do before and after is important. The difference being is that for longevity, I think people will get a benefit just going into they're opening them all over the place, go in, do plasmapheresis a few times. You will get a benefit. I don't deny that. But if you're chronically ill, I think you're kind of wasting your money to do that. Because I found in my own population, there were some people who, when I started doing this about 3.5, 4 years ago now, and I got the machine basically for myself because I'm old, and I'll get to the longevity part. I really think it's a big, important part there. But I knew some neurologists who were using this in kind of the complex chronic illness, my world, not the hospital world of we're preventing people from dying world. And they were telling me they were getting some great results. So I was excited, but I wasn't getting them initially. And I really backed off on it because it's, I said, it's a very expensive procedure. And, I don't want to waste people's resources for something that just sounds good. And so what we found in the people who are ill is that what's really important to do it well is to figure out how, what level of toxins are involved as best we can, because measuring toxins is that'd be another conversation we won't do today. a wasteland because there are very few companies that do it, and the ones that do it don't do enough of them. It's really a very difficult world. But still, the point is that the toxins, the inflammation, it's the more we can dial things in before and know what we're trying to fix after, the better it is. We got excited about it initially because in the world of PANS and PANDAS, this is an acute encephalopathy that happens to young people after strep infections. We think it's really more Bartonella than the strep, but anyway. And in adults, it also happens where it's an encephalopathy. They get, really severe neurologic symptoms, and a lot of it's driven by autoantibodies. You do it, and incredibly psychotic symptoms will disappear.
Wow.
Sometimes one, two. Now the thing is, they're going to come back unless you do other things. And we won't go into that. But in the chronically ill people, it can be a way to lower the load that allows other things to work. And if we prepare them, it can be a big step in just helping that body reset. Because it's the thing about chronic illness. It's not about. I shouldn't say it's not. It's often not about the infection that you think you have or that you may have, the infection or the infection, the autoantibody, the toxin. It's about how your body has responded, has compensated for those things that are keeping you really ill. So sometimes when we remove the factors that are the information, it allows us a little time to then go in and do things that, one of the problems with treating people with chronic complex illness is they often get worse when you do the thing that you think is going to help them. That's why a lot of people go, oh, you shouldn't treat Lyme disease, chronic Lyme with antibiotics because it makes people, besides mucking up their guts, they get sicker. And if they're really toxic, they often do get sicker and stay sicker. But if we can clear them out, it can be effective if needed. Hopefully it's not needed. So anyway, so in the chronic world, it really matters what you do before and after plasmapheresis. Now, in the longevity world, you can be a little looser. It's still going to be better if you're really dealing with the rest of your toxic load that you have, and obviously your lifestyle, and obviously your nutrients, and making sure, and this is what I was talking about very early on, I don't know if it would be maybe before we turn the recording on, is our ability now, which is just starting to look at metabolites and the balance of metabolites. That means the balance of the, the chemicals that you use to make energy and the lipids and the proteins, these things that are floating around in your blood. When we look at a bunch of them, we can see which pathways are not working relative to others. And then we can begin to impute which nutrients you might be missing. Because when we measure your blood, it doesn't tell us what's in your tissues. That's the problem. Okay, you can have wonderful looking vitamin levels in your bloodstream, but they might not be in the tissue. And the same thing with minerals. So that's why optimizing that's going to get you much better results. But as far as longevity goes, just removing these senescent proteins is going to give your body a little space. And if you're leading, and if you're really cleaning up your life, if you're not, still eating, lots of processed food and toxic things, not overdoing, drugs and alcohol, which is, I think it's really funny when people, think they can keep doing that. I mean, like I said, some people can, because there are many people who are 90 who abuse everything. So it's that's my other thing I have to remind people is that I've met very, very healthy people who die young. Okay, and very, very unhealthy people who live a long time. So all we can do is increase our odds. There's no guarantees in medicine at all, in health. Okay, so, but when we use plasmapheresis for longevity, we're getting rid of old information. Okay, and this comes out of, there were some original studies with the animal studies, I think by the Conroys, I think the Conroys or Conboys, I forget, I don't want to ruin their name, at Stanford, where they were, hooking old and young rats and mice up to, I think it was rats probably because they're bigger, to, parabiosis. They were combining their bloodstreams and finding that the old animals got younger and the young animals got older. So they thought, aha. And then it turned out, and some people still believe that it's the information from the young animals that are making the old animals younger. And that's where some people are doing plasma. They're actually giving people young plasma. I don't think is worth the risk, but that's another.
Why? What do you think the risk is
Well,
of
the
this,
risk in
like a
that is
young
that
blood transfusion? And when they do young blood transfusions, is it just the plasma
yeah,
or all of the blood?
no, just the plasma.
Okay.
Because it's plasma. Because God knows what else is in there. Because I mean, I have people who come to me who, like, God forbid, they're afraid of getting albumin. We use albumin as the replacement fluid. Okay, and albumin is a pooled product at this point. It's not. It's made from it. We draw blood from 1,000 people, and we take their. I mean, they don't. Yeah, and they take the albumin out. And they purify it, and that's the point. They purify it. And the purification process for albumin, as the same thing is for intravenous immune globulin, these are purified. They are clean. There's no spike protein left. Okay, I've gone through this process. I've tested them for spike protein, but more importantly, you go through the process of how it's made. Albumin is able to tolerate levels of cold alcohol, ethanol, that denatures and breaks apart spike protein. So it just isn't there. But welcome to the internet. Everybody's sure it's everywhere, and it can be, but it's not. It's not in the albumin or the IVIG.
Let me ask you this. There has been some research, if I remember correctly, showing something to the effect of like diluting old plasma could provide some of the same effects as infusing young plasma. Are you familiar with any of
Yeah,
that?
oh, exactly. Well, that's what we're talking about, because
Okay.
basically what we're doing is we're diluting your plasma. We're taking off the old plasma. We're giving you new albumin,
Okay.
and your body's going to make the rest of those materials that were in the plasma. So you're getting new stuff.
I see.
Yeah, some people have tried to do it just with dilution, feeling that if they take off some of it and they just put back saline, but you can only do that up to about 750 milliliters. So, not quite like 3/4 of a liter of stuff. And that's really not going to, I don't think that's very effective, because it's just, you're already spending the money on machines, what's expensive, in the nursing time, so you might as well get the whole thing out. And so what we're doing is we're diluting your plasma. Yeah. We're allowing your body to make new stuff. And one of the big things is albumin is is a toxic sponge. I mean, that's what it does. It goes into your tissues, it goes in the interstitial spaces, and it carries out toxins and lots of chemical debris. And it usually goes to the liver, where drops it off if it can, and you make new albumin. Albumin lives, a molecule of albumin about 3 weeks, give or take. So you're always recycling your albumin. But the point is that as the liver functions less well, which happens when your gut has been inflamed for years, because your liver has been working really hard dealing with crap that it shouldn't have to deal with, because you know that's just what happens. So all the blood from your intestines, except for the last third, goes directly to your liver, and that's where it's filtered. And you shouldn't be allowing a lot of toxins out of the gut. But when the gut is so-called leaky and it's just inflamed, a lot more goes across. The liver has to work a lot harder to get rid of it and put it back into the gut, and hopefully you'll get rid of it that time around. So the liver also has to then deal with this albumin and remove the toxins from it and metabolize them and get them out into your urine or through your stool. So giving a fresh supply, I think, is a really good thing. And I've seen this in healthy people. It's really kind of exciting when you do one or two. And I said, we're still working out how often people should be doing this. I mean, nobody knows yet. This is the Wild West. We're
And
figuring.
probably differs between somebody with a complex illness who's very
Oh,
sick compared to a healthy person.
yeah, but even with healthy people, I mean, forget about sick people. Sick people is another, but healthy people, how often you should do it, how frequently. I mean, should you do it? I mean, because people have looked at doing it once a month, or doing it twice a week, monthly, and so the information is just. I mean, the studies are just being done. Um, and it'll be a while till we really have good answers, because it's expensive, and to do the studies are expensive. Luckily, some wealthy people in Silicon Valley have put up money to do a bunch of work with Dr. Kiproff and the Buck Institute, which has really been, I think, very exciting. We're having data. We really learned because I never expected heavy metals to be a big deal because most of heavy metals are in your tissues. They're in your bloodstream for a very short time. But it turned out that this did remove a reasonable amount of more than I don't remember the numbers, but much more than I thought and other people who are in the toxicology world thought we would find. So this is a very good procedure. And the question is how young people should start. And again, nobody knows. We're making it up. Okay.
Let me ask you this. Has much work been done on actually measuring what is in the filtered compounds? What is actually ending up there? First of all, as far as stuff that shouldn't be there, I'm also curious what stuff is being maybe removed that should be there. What stuff from the body that should maybe be kept in, or maybe you have to be cautious with removing too much of. Like, are there particles with nutrients bound to them that are also being removed, and do we have to replenish certain nutrients after that? But what types of toxins, what types of compounds end up in that filtered component?
Well, we said some heavy metals, teeny bit of microplastics, more things like the DD, like the pesticides, herbicides, things that we really don't want to have in our system. Like I sent a bunch away to Switzerland, and we found significant amounts of DDT and DDE, which is a breakdown product of DDT, and that should have been out of America in the late 70s, but yet I've had 18-year-olds that we've done this because they're chronically ill, and they've had significant levels of DDE and DDT. I mean, we know this is there because they did this on umbilical cord blood, and they can find levels. So basically, almost all the fat-soluble toxins, are there, which is most of them that they're floating around the blood. Herbicides, pesticides, and the forever chemicals, PFASs, those come out. The question that I still don't know for sure is, are the volumes significant? I mean, the people doing the people that have done because we don't have all the numbers yet. The researchers who I know who are working with Dr. Kiproff and also with Paul Savage, who's starting to walking places for plasmapheresis. I mean, to be fair, they've done some pretty nice research too, and I've spoken to some of them. And though they haven't published the exact amounts, they've been impressed that it seems to be significant, that will affect health over time. That we are.
I'm curious about that too, because I think when you talk about, for example, pesticide residues or herbicides or some of the other things you mentioned there, microplastics, that it is removing them, that it's ending up in I think it's called the filtrate is the proper word.
Or the eluate, whatever you like. Yeah, filtrate.
What's the other word?
Eluate, but
eluate. Okay.
Filtrate makes more sense. Yeah.
Okay. I think the natural sort of interpretation of that by most people would be, oh yeah, it's pulling all of that stuff. It's a perfect filter that is, it's like a sieve that just captures any one of those particles or every one of those particles that of pesticide residues or heavy metals or microplastics and pulls it out into the filtrate. But the question is, the fact that you're measuring it in the filtrate, that you can detect DDT or you can detect glyphosate or mercury or microplastics. Well, okay, did it just pull out maybe the same proportion of what was already there in the bloodstream? Meaning, if you had, let's just use easy numbers here. Let's say you had 1% of your blood was something bad, microplastics. Right. Okay. It's probably more like 0.0000 whatever the number.
Much smaller, thank God.
But let's just say 1% for easy math. In the filtrate, is it also 1% of that material is microplastics, or is that substance? Meaning, did it leave still a huge amount floating in the bloodstream?
basically, if it's in the blood and it's in the plasma component, okay, if it's not attached to the red blood cell or the white blood cell, if it's in the plasma component, it's going to take it out. The thing is that most of this stuff is stored in fat tissue. Okay, so there's not high levels in the blood. Okay,
Right.
the idea is, but by getting it out, we're reducing the load because the body can't get the thing that makes these chemicals so dangerous to us is that we don't get rid of them well. We don't metabolize them. The liver isn't able to do much with them. It just puts them back into circulation. It doesn't dump them into into the urine, or I mean, into the blood that in a form that can then be urinated out or back into the stool through the bile. Lots of times it just gets reattached, stays attached to the albumin and gets recirculated. So that's why it's good to do it. We are removing, and what I can see from people is that it's from healthy people is that the inflammation in their body in a lot goes down. They do significantly better after they've depends on how they are. On some people who I didn't really think needed plasmapheresis. I mean, I just had one friend who was like 55 and is lived a healthy life. Does really careful about everything, and but she really wanted to do it, and so we did two of them. And we prepare. We do some IVs before and after. I do some things for I think that help lower the amount of senescent cells as well. But anyways, but just acutely, we did two over 2 weeks. Um, and she surprised me because she really had a dump of, she lost like 8 pounds, like within a week of, and she wasn't fat, you know what I mean? Like, so this means that because you lose the fluid is often there because it's trying to dilute the toxins that are in the interstitial space.
Ah,
So
interesting.
you really seem to be getting the stuff out of the space that's in the interstitial tissues are those spaces between the organs and between the ligaments and stuff. And that should be when you see there was a French guy who did micrographs. He had a like a laparoscope, but one that was microscopic, and he could see into the carpal tunnel, you know, and you could see this in young people. This really like crystalline, like white, kind of white, shiny structure. But as people aged, it kind of looked yellow and gunky because that's where your body stores the garbage. That's why people have those areas that are constantly tender and a little puffy because they're storing garbage in their tissues because their liver couldn't deal with it. And that's the thing. So by removing this, I think we are helping clear that space out. And that seems to be helpful. Again, I agree. I'm somewhat skeptical over removing huge amounts, but it seems to be enough that it gives the body some room and it does good things.
Are there any risks of it? Are there any potential? Is there any potential for harm?
Well, that's the cool part. Yeah, you can always hurt somebody doing anything, but you really almost know. I mean, what the side
Skydiving
effect?
is considerably more dangerous than
Oh,
drinking
oh,
water, though.
oh, yeah, no, but this is, you got an IV in one arm and an IV in the other arm. And at any one time, there's only about 120 cc's of blood in the circuit. So, if the machine stopped working, you lose 120 cc's of blood, which is when you go give blood, they take about 400 cc's. So you're not losing too much blood. Again, unless you're a very tiny person, then it could be not so good. The big issue that people, the symptoms that people have is we use something called citrated dextrose, which is citrate in the circuit, not in your body, but in the machine. So the blood won't clot when it's going through the machine. We introduce citrate, which binds calcium, which prevents blood from clotting. Okay, when there's not enough calcium, the whole clotting cascade can't happen. And so people, and it binds a little magnesium as well. So sensitive people can feel a little dizzy, lightheaded, a little that feeling of like numbness around their lips and stuff. Well, we usually deal with that by having people take some calcium citrate orally beforehand, and we also in the IV sometimes we add it to the albumin directly, or we just put a bottle in between the albumin bottles to put back calcium and magnesium, and some other trace minerals that we think is a good idea. But no, there's no, people don't die from this. Okay, there's no fatalities. You're not going to die. Um, uh, yeah, it's a funny because it's a closed system. Basically, it's just taking stuff out of your blood and we're putting back albumin and your blood.
Well,
So,
could,
um, yeah.
on that point, I'll tell you, in general, in among our friends and colleagues, what a lot of people do is there's this popularity of sort of IV related treatments, IV infusions of nutrients
Mm.
and things like that, and there are bars that
Oh yeah, you get it anywhere
you
now.
can go to, little
Yeah.
stands, and
Mm.
often at these health summits you
Mm.
see these little pop up sort
Mm.
of stands of, here, come get your IV vitamins and your IV glutathione and your IV B vitamins and whatever else, Myers cocktail and that sort of stuff. What has always been sort of at the forefront of my mind, and why I have a big aversion to that, apart from the fact that we're not necessarily designed to get direct infusion of vitamins into our bloodstream, circumventing the oral route and the digestive tract, but apart from that, is it's plastic bags with plastic tubing. And obviously, there's much more awareness around plastics now, not only of the microplastics concern, but of BPA, BPS, other chemicals that are used in plastic and PVC. DEHP is another one.
Yeah.
That's a hormone disruptor. And so, I mean, even if, let's say, there was a legitimate benefit to whatever is in that bag of fluid being infused into my body, well, now I have to balance that with the potential risk of chemicals from that plastic also being directly infused into my bloodstream.
Yeah.
What are your thoughts on that? And do
Well,
those same
again,
risks also apply to plasmapheresis?
yes and no. Because they do most of the time. I mean, we get bags now that don't have the DHEP and all those other
Okay.
chemicals. And the tubing, I get it. It's been a while. I should have this off the top of my head, but I've forgotten. But I did look into this because that was a big question. Is what's how much exposure are we having? And the membranes, they have made sure that these are not leachable as far as we know. They're at this point, they're going the next generation of the plastic, the thing that's used to hold the stuff in the centrifuge will be, it's like a silicon derived thing that doesn't leach at all, because no, that's definitely an issue. And because that was a big deal. I mean, like that's why for many years we used to try to use only glass bottles, for the stuff we did for IVs, because that was a big issue. But now most of the companies have switched to the things that don't leach. That is definitely an issue. But the thing is that we see much more. There are many more reactions. I mean, if you're going to get IV, high. I mean, I personally like high dose IV vitamin C. For me, it's like a miracle thing. If I get a cold the first day, if I do that, it's gone, and I don't get post-viral fatigue. I'm one of those
Mm.
people who get post-viral fatigue. I can have a minimal cold and I'll be like pushing for 10 days afterwards. And so, but if I do the vitamin C, I'm fine. But other people, I do other IVs, I don't feel anything. We're all very different. I have some patients who every IV is like a miracle for them, and I've done most of them and I don't feel anything. So we're different. We need different things. But for this one, I think this is one that I think the changes are significant enough in the people that I've seen in their long-term health, that I think it is worth the risk. That I think the risk is so tiny because, yeah, I mean, other than the possible materials in the tubing, which is a very small, short exposure, it's so safe because we're not really adding. It's not like a complex IV that we're adding lots and lots of stuff to. We're just getting magnesium, calcium, and sometimes a little potassium in there. So it's very safe.
Does the risk benefit calculus change, do you think, depending on who the person is, a healthy person versus a person with serious illness. Maybe they've tried lots of other treatments without much benefit, and they're looking to try something that might potentially benefit.
If somebody's been ill for a long time, I'm less likely to jump up and down about doing plasmapheresis without doing a lot of other work first. Okay, because I just don't think that you're gonna that that at least in my hands, I haven't. I've heard miracle stories, but that's not what I've seen. I've seen that people improve if we do the right things around them. In the healthier people is where I've seen. I think I feel is a more unrestrained yes, which is kind of weird, considering this is a big intervention. But the long-term benefits of of giving your body a chance to reset and lower this inflammatory load. Again, on the theoretical plane, I wasn't, well, I was sure. I mean, it's me. There was just something about it, like it's your gut. I read about this stuff and I thought this makes sense to me, mostly because of the information molecules you're removing. Because again, you're allowing a reset of the system. And it's what I've seen. I've seen people who are, I said they're walking, they're maybe not the healthiest people on the planet, but they don't have any, illness that they would come see me for. And those are the people who after two, or many times I like to do two, like I said, in a week, or, one a week for 2 weeks, something like that. And then repeat it again in a month or two. And after doing that for 2 or 3 times, their general overall health and well-being seems to improve, and I'm hoping that that is going to continue. Now, this is way too early to know. Dr. Kiproff was involved with a study. They call it, I think it was called the not the Amber study, but it's something that sounds just like that. This was back in, I think, 2010, 2012 to 16. They did plasmapheresis in people with dementia, with early to mild dementia, and they saw some benefits. It wasn't rocket science benefits, but I do feel again that it is useful. I recommend again in the people who are going elsewhere for stem cells. People who are leaving the country to get not just stem cells we have in America, but some things that are, I think, a little next level. I really do feel that plasmapheresis before is going to make that work better. Is going to remove a lot of the noise that's that's in the system. The trick is that we're just removing a lot of stuff that is interfering with clear communication in the body for a short time. I mean, that's to your point, is that, cytokines diminish, but they're back within days. The autoantibodies are back within, usually weeks to months. I mean, if you haven't dealt with why they're there. But just the big cleaning out of the system and putting in the new albumin seems to allow a lot of the healing that was interrupted. So this goes back to the whole point that I made in the beginning about these. It's not. I don't think it's just the senescent associated proteins, but it's any. Well, I guess they're all technically all senescent associated proteins. It's the fact that we are a mosaic of partially healed cells just by living and by removing the proteins that keep those cells alive. Okay, and keep feeding back to them and to the other cells in the body that there's something amiss. I think we're giving the body a chance to get back to a better homeostasis, or allostasis, I guess, however you want to put it. I think it's I've been impressed with that. I think for people with chronic illness, I'm still working on it, how to do that the best. I think it's going to take another year or two of experimenting, of seeing what's removed, because we're trying to get better labs for figuring out what's coming out in these different illnesses, if it's more of one toxin or the other, and how to support them, in before and after, because that's really the thing. If you've been chronically ill, I don't think just changing the water, once or twice is going to make everything better, but it's going to allow other things we do, I hope, to work better. And that goes back to what I was talking about in the very beginning, is that now, through the wonders of modern technology, we're really I'm beginning to have a better idea of what that person is really, that their system is deficient in. You see, it's not just the absolute number, but actually seeing the pathway that's not working well and how we can support that, or how we can look at their genes and see if, really they just have a weakness in absorption of the nutrient that's needed. So maybe they need more of something. That's when we're speaking in the beginning about wellness, like why I didn't go into the wellness medicine when I got out of medical school is because I didn't know what people needed to be well. I when they were really sick, I kind of knew where to look. And so now I think in the next year, 2 years, the amount of exciting tests that are coming out there that are measuring millions of things that we don't know what they mean, but with AI, we're going to be able to see quicker what they mean. Okay, and then we're going to be able to adjust and be able to help the system find out how to be healthier. Now, again, this doesn't, this goes back to what we were talking about in the beginning. It's still, you still need a commitment in this day and age to have a healthy lifestyle, because if you don't have a commitment, the push is to have a lifestyle that no matter what we do is probably not going to be enough. Okay. And it's getting back to balance and getting back to nature. I mean, I just, my last thing, I'm going to wind up here, but just getting back to, I have been so impressed when I meet people who have, really lived in nature, or just the times that I get to spend just in nature and the brain quiets a little bit, and you're realizing that you're part of a system, that there's a an intelligence, a life force around you. I mean, if you can settle, I mean, I know in this modern world, everybody, no, that's the reality. And if you settle into that, and if you begin to feel what's really happening, your body will resonate at levels that healing can happen, because it's that resonation, that energetic. I mean, that's why the sunlight is so important, and just the people you're around are so important to, I think, have a better chance at being healthy. You still can be the nastiest son of a bitch and do fine. But I do think that health and happiness is in your heart if you can open up to the world of nature around you, and listen less to me, and to what new chemical I can find that's going to make you better.
Yeah, absolutely. I, Eric, I almost want to end on that note because it was beautifully said. I have a couple more questions for you, though. One is just practical advice for people if someone is looking into plasmapheresis. If your salesmanship here was successful in convincing people that they might want to explore this, and they're considering going to a clinic to do this, what are some questions or things they should look for, questions they should ask to make sure that maybe related to the technology or related to the how they do the procedure, the before and after, different aspects of doing this that people should be aware of?
Okay. Well, for the technology, it's pretty straightforward. There's two main machines that are used in America. They're kind of all, they're both great. They both do well. The people who use them, they have to, the nurse, basically it's the nurses who do it. They're well trained. I mean, the people who sell the machines won't let anybody use them who doesn't, complete their certification. So you're not going to walk in and, at least you shouldn't walk in and find somebody who doesn't know what they're doing. So on that level, I think, it's pretty much the same. Part of, I have an issue, I think, for anybody who has any kind of health issues, I think you're better. I think for anybody, running it slower is better than faster. A lot of the places, because it's about money, you can run this if people have good veins, you can run it, good blood flow, you can run it in 2 hours. I kind of think 3 hours plus is a better speed. I just think, I mean, it's not that I think, it is more efficient. You get more out. And I just think it's easier on the body. Again, for a healthy person, I don't think it's a big factor. For people who are ill, it is a big factor, because when you're ill, your system is often just the fluid shifts alone can make you not feel well. And again, it's transient. You're not going to die from it, but you'll feel lousier. And some people, once they start to, if you're ill, when healthy people feel bad, they usually feel better the next day. Because many people will feel kind of like a little worn out after the procedure, but they'll get a good night's sleep, often sleep really deep, and feel fine the next day. Sick people, not so much. I've had patients who've had chronic fatigue, who in the beginning that I didn't prepare well enough, that they were exhausted for a week. And it's because we didn't prepare, and the toxic, when you're really toxic and you remove a lot, well, more will come out of the tissues. Okay, it's not a one-way street. I mean, you will get more out of the tissue, and if your body can't handle it, that new stuff can make you not feel well. Okay, so the speed I think is nice, and again, I think to talk to them about how they support you before and after. And I feel most of the people who are doing this do have programs where they are making sure that people are well hydrated, their minerals are up, their nutrients are up before, and supporting them after, because you really need, this is where I don't always love a ton of supplements, but a reasonable amount can be needed because your body is now able to work a little harder. And so having the right nutrients can be helpful. A lot of places, have a standard nutrient package. Again, it gets more expensive, but I like to do testing before to make sure that I'm giving you just what you need, and not, because I don't like taking a lot of stuff. I mean, I'm a terrible supplement taker. I'll take nothing for a month, and then I'll take a few things for a while. But there's times when my body might need it. And this is one of those times when you're cleaning stuff out. It's a time to really have the right nutrients to let your immune system and everything work optimally, because this is what you're looking for. This is what you're spending the money on, is to kind of reboot the system and bring you to a new level. So those are the main things, is just to make sure that people are paying attention to who you are before you start this, and what it is that you might need to get the most out of it. Because I said, this is not like getting, a vitamin C IV. You're looking at probably 10 to 15 times that cost. So you want to be thoughtful and make sure that this is the best way to spend your money, because if money is an issue and you're chronically ill, I wouldn't be doing this unless you really had a long discussion and were sure this was what you needed. Okay. If you're healthy and have money to burn, I think it's a fine thing to do. If you're healthy and you have limited resources, I would consider making sure that you make more time to walk in the park and exercise and breathe and do other things, rather than just get plasmapheresis, because you're not gonna this isn't gonna overcome an absolute sedentary lifestyle. So don't waste your money if that's your thought.
Eric, one more question for you. Big picture, not on plasmapheresis specifically,
but
more philosophical than anything.
Yeah.
You said at the beginning of this discussion, when you were talking about Band-Aid medicine and doing that kind of work, first of all, the way that you spoke about that is very interesting, and kind of most of the time somebody talks about Band-Aid medicine, you would hear it framed in this very negative way, where it's like, oh, that's just Band-Aid medicine. Really, we need to work on natural health and nutrition and lifestyle, and that's the typical sort of framing that you would hear that conversation pop up. But your framing was different. You said you kind of embraced Band-Aid medicine and said something to the effect of like, yeah, I want to get really good at it. I want to get really good at kind of helping people with specific problems fix those specific problems. And then you said in passing, I wrote this down. You said to keep you alive long enough for the body to figure out how to heal. I think that there's a lot there, and I also I don't want to put too many words in your mouth here, but the contrast with some doctors strikes me, because some people really conceptualize themselves, and I feel there's a lot of ego in this for many people, conceptualize them as the healers, the ones who are doing the healing for the patient. And sometimes people can be extremely egocentric about that and identified with this sort of healer who is the one performing this sort of miracle on the person. But your framing was to keep you alive long enough with this sort of band-aid medicine for your body to figure out how to heal. So I'm curious if you could just, you said it in passing, but I'd love for you to just speak a bit more about your philosophy on that.
Well, you know, I have always listened to people, okay? And when you listen to people, and you believe them, you wind up over years getting other people's failures. And at this point in my life, I only see people who, have tried lots and lots of very good doctors and people who I have learned from, who are, I think, are really smart. And so I know that I don't have the absolute answer for them. I just know that if I keep listening, I'm going to hear the hints of of the support their body needs. Okay. So when I don't do I mean, I love magic. I love magicians. I love healers. I mean, I work with many healers. Okay. But one of my favorites is this Chilean fellow. And as he puts it, I'm just your cheerleader. I'm not the shaman. I'm not healing you. Now, there are people who can go places, I believe, and I've seen, who can open the doors to really allow your healing. Okay. And I guess that's the most I would say is that I hope by modulating your symptoms, because that's what the Band-Aid medicine does. It addresses symptoms. Okay. Is that, and sometimes by modulating those symptoms, by getting you in a place where you can find your own force, and you can align with your own healing ability, or just get out of your own way. I mean, because it goes both ways. A lot of just getting out of your own way, and because this prefrontal cortex, which I don't have a good one. That's maybe why I the part that thinks it can control everything. Okay, isn't really there to help you heal. It's there to help you survive in humanity, to survive in culture. Okay, you need to go deeper, more primitive, to find the places to heal.
Mm-hmm.
And so you got to get out of your own way. And so everything I'm doing is trying to cut some of the noise, because what most people who are chronically ill fear is what's in their bodies. Even if they're calm and cool and collected, the body is in a state of alarm. And that in your limbic system often triggers fear. And that's sort of like the way I want to like remove the senescent associated proteins that are signaling keeping your body sick. I want to, by giving you some space from some of your symptoms, allow that fear to diminish, that survival fear. And again, I don't mean like being a fearful person. It's just what happens when everything feels bad. To allow you to connect, and to allow that deeper part you know, that's our inner self, to begin to get back in control. And because our modern world is so much about control and protection, and that's not where the healing is. Okay, because that's not where the energy is. I think I've told you this before. This didn't take me any energy. Okay, your muscles contract, doesn't, you don't use ATP for that. That is where I use my ATP, when I have to relax them. Okay. But if you don't relax them, they can't contract again. And so it's the same thing in all levels. So the band-aids are there to allow a little bit of ease to come into life. And the more ease we have, the more likely we're going to be able to find what we need, what you need for your healing. Because I've been doing this long enough to know that I don't know. I just keep looking for lots of answers until I can find the ones that fit the person in front of me. And that's the name of the game. And that's why we keep learning, because yeah, humanity's got a lot of people out there. There's a lot of different ways to be sick. So anyway, that's my story.
Eric, thank you so much for coming on the show again for time number 3 or 4. Is yet to be determined. I'll have to look
Yeah.
up how many times you've been on the show. Always a pleasure having conversations with you. I always learn so much. This was fascinating. I didn't know much about plasmapheresis coming into this. As I said, I just generally avoid stuff where my blood is being taken out or stuff is being infused into my blood as a general rule. But you've sufficiently piqued my interest. I'll say that. And yeah, I really enjoyed it. Thank you so much. And where can people get in touch with you, work with you, follow you? Where do you want to send them?
Oh, just, I'm not good. I guess GordonMedical.com. It's named after me, and I believe I'm sure we have an Instagram site and a this site and a that site. I must admit, I do my best to avoid. Yeah, I like watching videos on YouTube that I learn from. But other than that, I don't do much on the phone. But we're on anything that's in social media. If you put in Gordon Medical, you can find us. We do have a Gordon Medical forum, which I am very interested in because that's when I talk. Sometimes have people have Ari on and people who I'm interested in learning from. And that's a time when you don't listen to me, thank God, where I'm there listening to other people and trying to share what's new out there because it's as we keep creating new diseases, we keep creating new ways to heal and find new ways in. Because I just one last plug, not for me, but for people. I want to put together. I've interviewed probably at least 15 or 20 people who work in the psycho-spiritual domain over the last 5 years since I've been doing interviews. And one of these days, I want to put them all together so people, because you have to shop and find what resonates with you. Because, I mean, yeah, we are different beings and we all can learn from others, but they have to be speaking the language that resonates in our being. And so don't give up because you've seen some therapist or listened to some guru and it sounds like garbage. Keep looking because it is. I love the biochemistry, but at the end of the day, the magic is in your soul. So
Mm.
good luck. And Ari, thank you as always. It's so much fun talking to you. You let me ramble, and I just hope your audience doesn't object.
Well, you're one of few people that I actually enjoy your long rambles.
Okay.
I've always found your mind very interesting, so I like to let you just kind of go and uninterrupted and see where your mind takes us.
Well, thank you. I'm working on trying to keep it more linear, but we'll get there someday. Thank you so much. A pleasure as
Thank you, my
always.
friend. I look forward to our next conversation.
Yeah, me too. Bye bye.